natin.
Kasapi tayo sa KBP, yan ang kapisanan ng mga broadcaster ng Pilipinas. Ito po ang inyong FEBC Radio TV. At ngayon po dako na tayo sa ating malayang talakayan. Nasa Zoom po natin ngayon ang dalawang mga panauhin po natin dito sa ONP, si Professor Guido David ng Octa Research Team. At syempre nasa linya din po natin ngayon via Zoom si Dr. Ana York Bondoc, ang ating pong kaagapay na pulmonary specialist mula sa St. Luke's. And of course, meron din po siyang advocacy on medical literacy. Magandang umaga po, Professor David and Dr. Ana.
Yes, hi, good morning. Good morning, Heidi and Dr. Ana.
Good morning, Dr. Ana. Mukhang nakamute ka. Ayan, di natin naririnig. Oo, pa-check muna, Dr. Ana, yung audio po ninyo. Oo, check. Good morning, Dr. Ana. Wala, hindi natin naririnig. Okay, pa-assist po kayo kay Absidy, or kay Chris, dito po sa ating Zoom ngayon. So, unahin ko na munang tanungin si Dr. Guido David ng Octa Research. Sir, ECQ po sana, yung gusto po ninyo for another week. Tama po ba?
Well, actually, yung sinend naming recommendation sa IATF, we recommended either ECQ or 2 weeks na MECQ. So actually, nasa recommendations din naman namin na kung gusto nila medyo magluwag, MECQ, at least may balancing, parang balancing siya between yung public health and yung livelihood. May mas mga makakalabas for work na ibang mga kababayan natin. Pero hindi naman tayo nagluwag ng todo-todo na malalagay at risk yung ating public health, yung mga hospitals natin na puno pa rin sa ngayon.
Okay. So, Professor David, dun po sa mga numbers po natin, nung nakalipas na 2 linggong ECQ, ano po yung mga salient, mga information na pwede nyo po ibahagi po sa amin na napansin nyo po dyan sa Octa Research?
Yes, Heidi. May mga nakita tayong positive indicators. And yes, naiintindihan natin, may mga kababayan tayo nagsasabi, but parang nag-worsen pa, parang we're still seeing high numbers, 12,000, 11,000. Pero yung overall trend, firstly, yung reproduction number natin, nag-decrease na siya, 1.24 from 1.88 before nag-starting ECQ. So malaki na yung binaba niyan. What that means is, pag yung reproduction number natin bumababa, close to 1, malapit na tayo mag-flatten yung curve. Ibig sabihin, ng flattening, hindi naman mag-zero yung cases, pero papunta na tayo sa downward trend. And hopefully by next week, maaabot na natin yan, magla-less than 1 yung reproduction number natin. And yung growth rate natin sa NCR, actually nag-negative growth rate na rin tayo. So ibig sabihin, mas mababa yung average cases this week compared sa last week, yung 1-week growth rate natin. And maraming LGUs sa NCR na pababaning cases, kabilang dyan yung Marikina, yung Pasay, malaking binaba ng mga yan, pati na rin Mandaluyong, and even Taguig, even Manila, and even Quezon City may negative growth rate. Hindi pa yan clear na downward trend, kaya siyempre gusto natin magpatuloy pa na pagbaba yung cases para masabi nating downward trend, kasi minsan growth rate yan, so minsan pwedeng magbago-bago pa yan, pero gusto nga natin magpatuloy siyang pababa na para magkaroon na rin tayo ng pagluluwag sa hospitals.
Okay, so good job yung mga LGUs na na-mention po ninyo, Professor David. How about, may mga napansin po ba kayong increase sa ibang areas naman or ibang LGU dito din sa NCR? Well,
ang nangyayari kasi, yung kung saan yung unang nagsimula yung surge, like sa Pasay, mas nauna nilang na-control yung surge. So pababa na yung cases doon. And then there are other places like Muntinlupa, hindi agad nagkaroon ng surge doon. Ngayon, may tumataas pa rin yung cases doon. So actually, parang Muntinlupa na lang yung talaga tumataas. And then Pasig, slightly. Pero yung Pasig halos malapit na rin siya mag-negative growth rate. Pero outside the NCR+, tumataas pa rin sa Bacoor, which is concerning kasi sa ibang areas like sa Antipolo, pababa na yung cases. And then outside the NCR plus, nakita natin, for example, sa Santiago, sa Isabela, may increase pa yung cases. So, and then there are other places na outside NCR plus, tumataas ng konti, pero yung numbers naman nila mababa pa at the moment.
Alarming po ba yung sa Bacoor, Professor Guido?
Hindi naman. I think hindi naman gano'ng kataas yung growth rate niya. But I think we still have to monitor closely itong nangyayari sa Bacoor. And ganun pa man, even though we're seeing negative growth rates all over, may napansin kaming spike sa mobility last week. And I think yung cause for the spike sa mobility, ibig sabihin nag-increase yung mobility was due to the ayuda. And so syempre, narinig naman natin, ina-address na yung concerns natin dyan. Kasi these are possible super spreader events, yung pagbibigay ng ayuda kung hindi maayos yung distribution system. So I think this is something na ina-address na ng mga local governments because yun nga, ayaw naman natin na may mga magkakasakit dahil tumuko sila ng ayuda. Yung ayuda nga, pang tulong natin sa mga nakukulangan, may nawala ng trabaho, pero ay naman natin magkasakit din sila or magkaroon ng super spreader event sa pagbibigay ng ayuda.
Dami nga pong napabalita na nagkulumpun yung mga tao nung nagbigayan po ng ECQ ayuda. Kaya panawagan po rin ng mga residente gawing bahay-bahay daw po ng LGUs yung pamimigay ng cash aid na yan.
Sana nga pwedeng bahay-bahay. I mean, of course, hindi ako aware sa logistics ng mga barangays kung hindi nila, kung kaya nila to or something. Pero syempre administrative issue yan. Pero sana nga magawa nila ng paraan. Ang alam ko sa ibang lugar tulad sa Quezon City, ginawa nilang segmented na parang may listahan sila tapos parang papapuntahin na lang. Kumbaga parang by appointment. Baka mas okay din yung ganon para at least ma-limit nila yung number ng pupunta at a period.
Kumusta po ang rates sa Quezon City, Professor David?
Well, Quezon City may negative growth rate siya, minus 17%. Although yung reproduction number niya hindi pa noon bumababa less than 1 tulad sa NCR. Bumababa na rin yung attack rate niya. Pero yung hospital bed occupancy, ICU occupancy, matataas pa rin dito sa lugar nito. All over NCR mataas pa rin. And I think some people have some people have commented na parang yung numbers natin don't reflect yung yung hospital occupancy natin. I think we're seeing based sa data na may hospital beds available pa, pero from what we're hearing, yung mga ako mismo may friends ako na looking for seeking hospital care, hindi namin matulungan kasi mahaba yung waiting list sa hospital sa emergency room.
Oo, yung iba nga daw pong pasyente nakakaabot na ng Nueva Ecija.
Yes, baka may nagpupunta na sa, lagpas na yun ng Pampanga, pero we can ask her si Dr. Bondoc kung kumusta yung hospital sa kanila.
Oo. Dr. Ana, try natin.
Good morning, Miss Heidi. Good morning, Prof. It is nice to be with you this morning. At ang ganda ng balita ni Sir, ano?
Hi, good morning. Good morning, Doc. Yes. Hopefully maganda yung balita natin next week. Hindi pa ganun kaganda yung balita sa hospitals, pero at least yun nga, we are seeing improvements, and yan yung mahalaga. That trend is yung what's important.
Okay. So, Dr. Ana, itong mga na-mention ni Dr. Professor Guido David, mga gains natin nitong last 2 weeks. Ano naman po ang naging observation po ninyo ngayong hanggang katapusan ng buwan ay MECQ na, yung NCR plus bubble plus yung iba pa rin pong mga lalawigan like Abra and Isabela.
Miss Heidi, thanks for this. And I'd like to answer the question po ni Prof na kumusta po yung bed situation po dito po sa Pampanga. As we know po, the Pampanga yung naging border po ng ECQ eh. From Bulacan, they have 4,000 cases. Sa Pampanga naman, we have 1,000. So talagang there's a difference. But I went to the Jose Bilingad Memorial Medical Center. Ito po yung PGH ng Central Luzon. And all 381 beds po are occupied. All 381 COVID beds are occupied with galing po ng Metro Manila is 30%. So mataas din po ang occupancy rate dito.
Okay, so pero hindi pa naman punuan, Doktora Ana.
Well, that's 381 maximum beds. Kaya lang, I'd like to share something, Miss Heidi, if you look po, nasa amin po yung mild, moderate, severe, sino po ang na-admit? 50% po ng nanga-admit sa private is actually mild. And it's actually only the public hospitals which are able to properly triage patients. Unfortunately po sa ating situation, dito po sa mga ospital and private system, basta may pera ka, i-admit ka. Okay? Hindi ka na triage. Basta may pera po kayo, you will be admitted. And can we blame naman po yung mga mild, may nervous po sila the moment somebody becomes positive in their house. Baka wala na ho silang ibang kwarto, may pera naman ho sila, admit sa ospital. And unfortunately, once they get into the hospital, they do not want to leave po for 14 days. Siyempre po gusto nila matapos sila doon. Kasi baka ho maging severe or moderate and then pagdating po nila wala ng kama. And that is one of the reasons po kung bakit po fully occupied ang ating hospital beds. These are not fully occupied by the moderate and severe. A large part of these are mga mild po na nagkakaroon po ng nervyos. May pera po to enter the private hospital. And of course, siyempre may pambayad, they admit. Sa public hospital, this is the only place po that we can actually properly triage patients. And sa JBL po, which is the PGH po Central Luzon, lahat po ng 381 beds is occupied po by moderate and severe patients, which is the way it should be. So sana po, of course, we cannot blame naman po yung pamilya ng mga mild. Baka naman ninenervous talaga sila. And I understand that. Plus, kulang po yung home care support. So it's actually very good po na nagkaroon na po ng mga home care programs ngayon. They will discharge from the emergency room po to go home, pero hindi po mag-isa na lakay sa bahay. Tatawag po sila araw-araw. So that is very good.
Imo-monitor na lang po yung pasyente.
Yes, that's a great way po to decongest the private hospital beds. And yung mga talagang mild siguro, a lot of them are also being discharged po sa mga quarantine facilities na meron naman pong kahit papano na medical advice na ibibigay. Ang hirap po talaga to stay home lalo na po kung senior yung nanay nyo, senior yung daddy nyo, then they'll just stay home. Say, umuwi kayo, then wala mang ibibigay ng gamot. Mabigat so you really need support.
Professor David, sa lente po ninyo, kailangan ba nating mag-mass testing?
Yes, mass testing would be ideal. Actually, last year pa namin sinasabi yung or ina-advocate yung mass testing. And we understand na siguro there was no urgency last year because, well, I mean, hindi naman ganun karami yung cases natin. Napababa natin yung cases from September to mid-February, mababa yung cases sa NCR. Pero mass testing would be useful. Kaya lang sa ngayon kasi ang problem is kulang na yung testing natin So even our PCR testing, medyo precarious na because our positivity rate is so high, nasa 24% sa NCR. Bumaba na ngayon from 25%, but still it's so high. And there was, and this is an interesting tidbit, there was a 3-day stretch last week sa Veterans Hospital. Yung positivity rate was 89%. So ibig sabihin yung mga seniors na I guess Veterans Hospital, so mostly seniors yan. And that was 89% positivity rate for seniors. So parang 9 out of 10 na nagpa-test are positive. So it means medyo talagang kinukulang yung testing natin ngayon. Or as one of our colleagues pointed out, there's also selective testing. It means na yung mga nagpupunta sa testing centers or nagpapa-admit, talagang almost sure na sila na they have the COVID. Yung mga iba, they might be staying at home, hindi sila nagpapatest because natatakot silang lumabas. So there could be behavioral aspects dito where we don't have the exact answer for these, pero these are just observations sa data na ang taas ng positivity rate. And that's why the Department of Health has augmented the testing with antigen tests. which is in a surge situation like ours, pwede na yung antigen test. They have a high true positivity rate naman yung antigen test. So it's if you get antigen tested tapos positive, most likely you're positive now. You don't have to get confirmatory PCR. Pero yung PCR natin medyo kinukulang. Ideally, we should have at least double what we're testing now. We're testing less than 30,000 PCR tests NCR per day. Ideally, it should be at least double this para ma-capture natin more of the cases that are out there.
Correct. Dr. Ana, anong take niyo po doon? Mass testing?
Miss Heidi, definitely kailangan po.
Okay.
But it's easy to say na dapat pong mag-mass testing. Kaya lang, kailangan po ng government support kasi majority of the people who need to be tested, wala naman po silang pera for the testing. So, hindi na silang magpapatest. Ganun po yun. So definitely, there has to be a support for the government for the testing. And number 2 po, dapat po, pulisin din po ng gobyerno yung mga umaabuso naman po dun sa mga presyo. So, there has to be policing po of the price kasi meron talagang, syempre, desperate yung mga tao. They're willing to pay anything. Ano po. Though I know may guidelines na rin po ang gobyerno regarding this. But definitely, sana po there was a place na mabilis po yung libreng testing. Yun po yung malaking bagay. And with regards po sa antigen, that's a really good test, katulad po ng sinabi ni Prof. Lalo na po when the positivity rate is high. Malaki po ang pick up talaga ng antigen. Ang problema lang talaga, pag na-positive sila sa antigen, hindi po sila maniniwala. As in, talagang it's a shock. So they need to get pa rin a PCR before you can fully convince someone to stay in their house.
Okay, parang gusto pa rin nila may confirmatory test, yung gold
Oo
standard.
naman, Ma'am Heidi, kasi talagang devastating naman ho if you tell someone you have COVID. Oh my God, OMG talaga. And then, iimbestiga yan. Paano ko na positive? Then maririnig niya. Mas maganda pa din yung PCR. Mag-i-insist po yan talaga hanggat makakayanan po nilang bayaran na magpa-PCR ho muna sila. Nobody wants to stay home-based po on an antigen test. Reality lang ho yun.
Okay. So, Professor David, alam po namin meron pa kayong prior appointment, ano? So, siguro po kayo na muna yung tanongin din namin, ano? Yung CAR, yung Cordillera Administrative Region, naging GCQ na po. So, ibig sabihin, ang laki po ng improvement po nila.
Well, I hope malaking improvement, but what we're seeing sa numbers, they still have significant cases, particularly sa Baguio, and medyo mataas pa yung hospital utilization sa Baguio City, but I think there might be some improvement. Ayun nga, of course, mas concerning, for example, yung Santiago, Isabela, the cases are increasing there. Ayun nga, I think sa Baguio yung concern naman is mostly the positivity rate and the hospital admission medyo mataas pa rin, although baka nagsa-stabilize ng cases there. Pero there are other places din na nagkakaroon ng increase, pero most of them are at a much lower scale. For example, nagkakaroon ng uptick even sa Bicol region. So we're monitoring these, pero wala pa naman sila sa scale ng what's happening right now is 80% ng cases nasa Calabarzon, NCR plus Calabarzon, plus maybe Bulacan and some in Pampanga. Pero 80% andito. Another 10% nasa CAR tsaka nasa Region 2. So you can see 90% of the cases andito sa few regions na to. Cebu is okay, Davao is okay. So, we're not seeing anything much sa Visayas and sa Mindanao. So talagang andito ngayon sa yung epicenter.
Concentration, okay. Last na lang po, Professor David, yung facing po natin sa pagbabakuna, ano po ang projection po ninyo ngayong second quarter na tayo?
Well, that's a good question. And syempre yung supply chain issues yung problem natin sa vaccines. Pero vaccines are very important. We did the calculations, yung 60 to 70% for herd immunity. Mababa na yan. This was estimated using yung reproduction number ng virus before, pero dahil may mga variant na tayo, yung UK and South African variant, we have to account for that na mas infectious sila, the reproduction numbers higher. So ang estimate natin ngayon is about 75%. And we really need 75% vaccinated sa NCR. Unfortunately, sa NCR, if we account yung mga minors na hindi pa eligible ma-vaccinate, that's already 28%. So yung natitirang 72% kasama seniors, we need to vaccinate that population para magkaroon tayo ng herd immunity. And that would be about 10 million. And I think we can get, the vaccines eventually, second quarter, third quarter. Pero syempre, we still have to address yung issue of vaccine hesitancy. Kasi in-assume natin 72% to get herd immunity na lahat nun magpapa-vaccinate. And there are some may hesitancy. So I think realistically, we might be able, kung hindi pa eligible yung mga minors, realistically, we will get maybe 45 to 50% of the NCR vaccinated. This will not be sufficient for herd immunity. Hopefully, we can almost fully reopen the economy na. Ang ano naman natin, guidelines or at least recommendations, even if we have the vaccines, we still have to wear face masks and do appropriate health protocols. Kasi although may vaccines na and we're hearing about the efficacy against severe cases, there's still a lot of unknowns regarding the vaccines, yung how they will respond to itong mga variants, maybe may future variants pa. And we know na magkakaroon naman ng booster shots itong mga vaccines. Pero nga, we don't know about the recurrence, yung reinfections, the infection rate. We're still learning about some of those things. So long story short, yung 75% for herd immunity is just a guideline, but we're not, it's just a target. But and ideally, we should vaccinate a lot of people. Pero there are other factors na baka it will even require a higher percentage of the population to get vaccinated.
Nako, ang dami po kasing factors na dapat i-consider. Kagaya ngayon, 2 weeks suspended pala yung AstraZeneca, iba for 59 years.
Well, yung supply chain issues yung right now yung pinaka problem. Pero once we get the supply, yung issues natin, syempre yung vaccine hesitancy, and then yung minors are not eligible. Pero definitely, it's most likely, we'll still have to be wearing face masks for the next year at least, because even though we're vaccinated, it's not clear kung madadala natin yung virus. For example, if I get vaccinated pero I get exposed to a case, baka madala ko yung virus. And that's why I have to wear face masks, because I have to protect the other people around me from getting the virus that I may be carrying. So yun yung sinasabi natin na even if we get maybe some level of herd immunity, we may still have to be wearing face masks for a while.
Huling-huling tanong ko na lang po, Professor Guido. This week ba may maririnig pa kaming 10,000 plus daily cases?
Well, actually, it's possible kasi may increases sa ibang areas, pero sa NCR, yes, hindi pa tayo nasa downward trend. So it's possible talaga we'll get 10,000. And we're getting 10, 11, 12,000 kasi we're also getting backlogs or late reporting. For example, hindi siya even. Last week we got maybe 6,000 in one day, and then biglang tatalon to 11,000. Pero when we average it out, we're getting 9 to 10,000 per day. So we might still be seeing those numbers. Pero hopefully by next week we'll be on a downward trend. Bababa na yung cases. And hindi naman yan totally bad kasi yung projections namin, if wala tayong ECQ, we would already be at 15,000 and going to 16,000 cases per day. So malaki rin naman na tulong yan. So when people say na, but mataas pa rin na numbers? Well, the fact is, kung wala tayong restrictions na ganyan, it would be much worse than what we are now. So the fact na medyo nagpa-plateau ng cases is already a positive indicator.
Ngayon, kaya gawin lang yung mga nararapat na pagsunod sa ating mga health protocols. Thank you po, Professor Guido David.
Thank
Stay
you, Heidi.
safe, mabuhay kayo.
Stay safe. Thank you then, Dr. Anna. Good to see you again.
Ayan.
Ako rin.
Dr. Anna.
Yes, Miss Heidi, ang ganda ng usapan, ano po?
Opo, kasi grabe ang daming mga kababayan natin ang hirap na hirap hanggang ngayon. Kahit na MECQ, di ba, very limited pa rin po yung mobility, yung mga bukas na mga negosyo. Kaya dapat po talaga pinapaintindi natin sa ating taong bayan, ano, yung ating mga small contributions, may malaking impact yan sa
Yes, Miss Heidi.
pangkalahatan. Oo, okay.
Definitely. Nabanggit po ni Prof yung vaccine hesitancy.
Oo.
Ako personally, I feel that the Philippines vaccine program will be successful.
Mhm.
Kasi po, ang mga Pilipino, we will derive po much confidence when we see people that we personally know, that we trust, na nagpapabakuna. Halimbawa, nakita niyo po yung kapatid niyo, papakuna. Nag-usap po kayo, how did you feel? Yung kapatid niyo sa nurse, after that, magkakalakas loob ka po. So it's going to be a bandwagon effect. Okay? And then number 2 po, I hate to say this, Miss Heidi, but really the surge really, na marami hong dati, pabanting-banting lang, hihintayin ko na lang muna yung ibang magpabakuna. And then they realize that people that they know personally are dying. So yung mga kapitbahay nila na isolation, na quarantine, yung kabarangay na matay. Yun po talaga, nakakatatak po talaga yun ng takot. And aside from the desire to be able to move forward with their life, meron din pong fear that is driving the vaccine. So kinikwento po sa akin, doon nga po sa hospital na pinuntahan ko, which is Jose Bilingad, dati po, when they did their initial survey, less than half wanted to be vaccinated. When I went there po 3 days ago, 90% na po ang nagpabakuna ng mga empleyado sa ospital. At marami pa hong naghahanap. And everybody is calling ngayon, gusto ko nang magpabakuna. So, this surge, aside from reminding us kung ano po yung proper health protocols, it also reminded us that hindi po biro ang COVID. People are dying. People that we now personally know. Kung ang dami nga hong Facebook, di ho ba, Miss Heidi, na nag-a-announce na matay yung lola nila, na matay yung kapatid nila. These are people that we know na ngayon unlike before na sino ba yung mga namamatay, hindi naman natin kilala, hindi naman tayo close. Ngayon po, it has become personal.
Palapit
So
na ng
yung
palapit.
hunt for the vaccine is also now personal. Ang dami nga hong nagpapasulat ng comorbidities na hindi naman ho meron. Please don't do that kasi kawawa naman po talaga yung may totoong comorbidities. But definitely it shows you po the level of interest and I would say desire to be vaccinated has really gone up. And ang problema po natin ngayon is now the supply chain. Ngayon ho, kung ma-supply natin yung mga vaccines, I do believe that Filipinos, mas tumaas na po talaga yung desire nilang mabakunahan.
Pero Doc, yung pabago-bago nating sa mga bakuna, dati kasi yung Sinovac, bawal ibigay sa seniors, tapos pinayagan natin. Tapos ngayon naman, yung AstraZeneca, binawalan nating ibigay sa 59 years old and above. And 59 years old and below, I mean. Yung mga ganito po bang parang urong-sulong, pabago-bago, nakaka-apekto po ba yan dun sa tiwala ng tao sa bakuna?
Yeah, what's happening? Yes. Okay. Well, first of all, let's address both issues separately kasi ibang issue ho talaga yun. So, puntahan po natin si Sinovac, okay? Why was Sinovac not allowed naman for seniors? Well, hindi po siya na-allow for seniors because it really was not tested. Because in the initial, naganap po talaga sila ng mga healthy 18 to 59 years old. And so that is really the tested population. Pero come to think of it, ano ba ang difference between 59 and 60? Diba? And between 59 and 65? Parang it was because of the trial. In China po and in different areas of the world, they are now giving Sinovac to all ages, including all seniors. Hinihintay na lang po yung datos noon. So ngayon ho, the FDA decided to allow Sinovac because 700 Filipinos po. Most of them were doctors. Ako ho, may katabi akong 85-year-old na nag-sign po siya. She's a pediatrician from San Fernando, Pampanga. She signed po that I am willing to receive Sinovac despite being a senior. So 700 seniors po na most of them were very educated. Mga doktor ho kasi yung first batch, di ho ba? So they were fully aware of the risks and kung ano po yung pinipirmahan po nila. And they are all okay. All 700 po are doing well today. So based on that data, I think it's positive po that the FDA, kumbaga walang nangyari ho doon sa 700. That's a big number, ma'am, for a trial. Ano? They are all okay. They are all educated persons po. They can report kung may nangyari po sa kanila. So based on that data, and aside from the data po, of course, coming from China and other countries, nag-agree po si FDA na to expand. So that is good, ma'am. Kumbaga, wala naman hong nangyari sa 700. Why will we withhold it from others na necessitating the Sinovac po? And yung sa AstraZeneca naman po, the risk of, we're actually, it's hard to, but we are actually at a good point po of stopping. Why is this? Because marami na pong nabakunahan na first dose. Ngayon, the second dose po is in 3 months pa. So we have 3 months to study po, or we have time to review and tingnan po natin kung ano po ang nangyayari. Again, none of the clotting has happened po sa Pilipinas. Okay? Most of it is in younger persons. And again, the risk po of clotting, as told po, is 1 to 4 in 1 million. Miss Lady, iklaro ko lang, the risk na tamaan po ng kidlat is 1 in 500,000. So mas malaki po yung possibility na matamaan ka ng kidlat kaysa sa maklat ka po ng AstraZeneca. I also, somebody sent me din po the probability of being having a clot from AstraZeneca is this same probability po of guessing the last 5 numbers ng cellphone ng kami na nakilala mo lang po kanina. Like if you meet someone na maganda dun sa isang party, well, wala nang party ngayon. Hindi na lang po natin sa Facebook. Tapos sabihin po niya, hulaan ko yung cellphone number mo. Kung makuha niyo
ganon kaliit yung
last
chance.
5 numbers niya, wag na po kayo magpabakuna ng AstraZeneca. Pero kung hindi niyo kayang hulaan, then it's a pretty good chance. But again, it's just being safe. Hindi naman po sinabihan na absolute na po yun. And again, I would like to stress, halos po yung entire UK na bakunahan po ng AstraZeneca. And there are only 27 people ata yesterday died. So ganun ho ka siya ka-effective. And I hope that we think about that habang gumagawa po tayo ng ating pong choices that our FDA is only being safe. Hindi naman ho sinabing hindi safe po ang AstraZeneca. They said they will review. And then, again, di ba, galit na galit tayo, asan yung mga bakuna. But as I said, we learn from the experiences of countries po na nauna. And we learn from them, we can review po the data, and we can see po how we can move forward. Ito lang definitely po, as we have seen from Israel, UK, nagbabaan po talaga yung kanilang positivity rate. Their death rate also went down. So, ito po talaga is really a good sign na vaccines work, vaccines are effective, and vaccines are the way out. Otherwise, doon na lang po tayo sa bahay for the next 5 years. And marami yung naiinggit ngayon kasi parang natatakot silang lumalabas ng bahay. Yung mga nabakunahan, well, again, you still have to wear a mask, you still need to be careful.
Correct.
Pero, marami ka pa, even if you're a senior, you still have a life to live. And the life that you have inside your house, wag naman ganon. Ang sarap mabuhay.
Kahapon nga, Doc, may dumating ulit. 500,000 ng Sinovac.
Yes. Miss Heidi, I'm hoping po, based rin po sa sinabi po ni Prof, siguro we should concentrate po muna in Metro Manila. Kasi kung 80% po ng problem, mapatay na ho natin. Kasi yung nangyayari po sa mga ibang lugar, they are all, if you look at it po, sa amin sa lugar namin, they are all seeded po from people who came from Metro Manila. So, eto po, if you can, parang, it's like, it's shooting off. May sentro tapos parang nag-aano siya ng mga maliliit po sa bawat lugar. If we can kill the head of the monster po in Metro Manila, yung mga mayor po sa ibang lugar, yung mga barangay captain, mabilis na lang po nilang mahahanap ngayon yung mga small na lumalaki. So, yun po talaga. I hope we concentrate in Metro Manila. And for the LGUs, yung asawa ko po isang mayor, talagang kailangan mabilis po tayo. Pag may narinig tayong positive, pick up kaagad at ilagay po sa quarantine facility. And then, household contact, isarado. Tapos na po yung problema doon.
O kaya talagang strict home care, Doktora Ana.
Pwede po. Opo. But sa mga probinsya, kaya po ang quarantine
Kaya pa.
facility. Kasi
Okay.
20 pa lang ho konti pa lang ho. And then support them with food para they will go. Sa amin po 100 a day plus 1 kilong bigas eh. Kasi people are not going to go to the quarantine facility by themselves, Miss Sadie, no? Kailangan, meron ka namang itutulong sa kanila. Pero may lalabas na sila sa bahay nila. But then once you explain it to them na para ho hindi mahawa yung mga kamag-anak nyo, and then number 2, meron naman hong pagkain and it's a very nice place, ay go na sila.
Okay. Oo. Huling tagubilin nyo na lang, Doktora Ana, para po sa ating mga kababayan.
Miss Heidi, I think that we are on the right path. Pero napakadali hong mahulog dyan sa path na yon. Isang party lang ho, quarantine na ho yung 100 na kumain. Or isa pong komperensya. Unfortunately, eating is one of the talagang kahinaan po ng pilit na laman natin pala sex, eating. So eating really ang kahinaan po ng Pilipino. So we need to be cautious po about events and about eating. And again, there is only one way out talaga kasi hindi naman ho tayo pwedeng magpulungan na lang ho dito for the next 5 years. So please, kung natawag na po kayo for the vaccine, please go. Kung hindi pa po kayo nagpapalista, please magpalista. And ako po, I got my second dose. 20 days na lang po. I am already 90% free from ma-hospital, ma-ICU at mamamatay. And I feel fine. So yun po yun.
Thank you, Doktora Ana. God bless you.
It's a pleasure, ma'am.
Opo, hanggang sa muli. Stay safe.
Kayo rin po.
Nakausap po natin si Doktora Ana York Bondoc. Kaagapay po natin isang pulmonary specialist ng